Hi and welcome to Burnshield. This very warm morning. Welcome. We are live streaming from Wadeville, Germiston, South Africa. Burnshield is a proudly South African product. We have some very exciting demonstrations for you today and I really hope you're going to enjoy it. I'm going to kick off and introduce you to our very special guest, Johan Jonck. He is the editor of Arrive Alive, and we're just going to have a quick word with him and find out how everything is going with him and how he's feeling right now, because he's actually going to be one of our volunteers in the demonstrations. So I'm going to pass you over to Johan. Johan, how are you feeling right now?
Yeah, all good, Carla.
Are you ready?
I'm ready.
Are you prepared?
I'm prepared.
Okay, brilliant. I'm now going to pass you off over to Max Di Domenico, one of the directors of Burnshield, and he's going to actually take us through this demonstration. So Max, without further ado, take it away.
Good morning, everybody. So this morning we're going to introduce you to the coolest product around, and that is what Burnshield is. So all too often when you buy a service or a product, you end up with two possible reactions. 99% of the time it's maybe okay, maybe not okay, could have been better. Very few products give you the sensation of being a great product, and that is what Burnshield is. How do we know that? Well, very simply, if we take a theoretical question to a burn specialist, one that has not seen Burnshield, and ask him how he would treat burns, he would say to you, firstly, minimize infections. Infection control in burn wounds is critical. The extent of the wound and the amount of damage that burns create increase the probability of infections. And when the wound is infected, it takes a lot longer to heal. Second thing I would tell you is, okay, it is very difficult to treat a patient that is in pain and in agony, so you want to treat the pain first before you can treat the patient. Third thing I tell you, promote wound healing. Burn wounds are naturally difficult to heal and take a long time and result in bad scarring. So if you can incorporate wound healing in your protocol, you reduce the healing time and the extent of the scarring. And what we're going to talk about today is the fourth thing I will tell you is stop secondary burn wound progression. So to analyze and to understand what secondary burn wound progression is, let's look at two wounds. Here is two wounds at time 0. The top wound slightly grows, the small wound, okay, left untreated. With time, it slowly progressed, and you can see the extent of the wound got actually worse than the initial wound was when it got burnt. The reason? Secondary burn wound progression. Here we see a second burn, a lot more serious, treated immediately with Burnshield. Over time, the wound was not yet significantly different. So, secondary burn wound progression, the wound starts at a certain size and slowly grows bigger if left untreated. To try and understand this principle, we quickly have a look at some skin biology. Here we have the three main layers of the skin. The epidermis, which is a thin outer layer which you normally see and feel. We have the dermis, which is the inner part of the skin. And then the hypodermis, which is anything below the skin. So, if we subject the skin to intense heat, as in the case of iron, the great insulating properties of our natural skin are compromised. Our skin is not designed to withstand extreme temperatures. So the heat will transfer through the skin barrier into the underlying tissue, the hypodermis. Now what happens? The heat that is in the inner part of your body is trapped, because the dermis now acts as an insulating barrier and prevents the heat from escaping through the skin into the atmosphere. So the heat starts spreading sideways and down. Secondary burn wound progression. So a small wound initially will grow in size sideways and in depth due to the trapped heat, which continues to cause damage in the underlying tissue. Secondary burn wound progression. So to eliminate that, you have to cool the wound, most important. Just a quick aside, the burn classification is based on the rule of 9, and this is what the first aiders use in order to determine the extent of the wounds. Burns are classified as first, second, or third degree burns, only superficial, slightly more damage, and once tissue is compromised, we classify the wound as a third degree burn. Right, so to prevent secondary burn and wound progression, we have to cool the wound down. So to understand or to apply our minds to how we're going to cool this wound down, we need to have a clear understanding of what temperatures we are talking about. Anything below 45 degrees might feel warm to our skin, but has very little effect in terms of damage to our line or our skin. So you can sit in the sun for a while, you won't get sunburned, you'll feel a bit hot, but that's it. So anything below 45 degrees will generally cause no ill effects. Temperatures between 45 and 65 will generally result in first degree burns. That's extended exposure to the sun, and you normally get reddening with sometimes with or without blisters. Anything between 65 and 85 degrees, we're talking about second degree burns, so now you're starting to damage the dermis part of the skin, and you can get quite irritable blisters and scabs. Anything above 85 degrees, well, that's a barbecue. So, in order to eliminate secondary burn wound progression, we typically have to reduce the skin temperature from 85 degrees down to 45 degrees. Okay, once you reach 45 or below, we'll have stopped secondary burn wound progression and eliminated any further damage to the wound. Alright, in order to call ourselves the best, we have to compete against the best, and we have to compare ourselves against the best. So who are our competitors? Number one, nothing. If you leave a wound untreated, clever scientists have determined it takes between 1 and 4 days for the skin temperature to return to normal. So left untreated, you could be causing continuous damage to the underlying tissue for up to 4 days. The most worldwide accepted protocol for burn wounds is approved by FDA and a lot of universities around the world, and their protocol proposes a minimum 15 minutes under cool running water. So if you take a burn wound, subject it to cool running water for minimum 15 minutes, you will achieve enough cooling to prevent secondary burn wound progression. Now, for Burnshield to be the best, we have to compare ourselves with cool running water. Okay. Couple of issues. Cool running water is not necessarily sterile. We've already explained that infection is critical to burn wounds. Burnshield is sterile. So applying Burnshield, no risk of infection. Applying any other water source will risk infection. We've said pain control is important. Burnshield provides immediate permanent pain relief. Cool running water will probably need secondary medication to reduce the pain. Third thing is wound healing. If applying Burnshield has been shown to promote wound healing and reduce healing time, cool running water will have no effect on the healing time of a wound. Alright. So now we're going to do a bit of a demonstration to see how effective Burnshield is at cooling the wound. And we have not been able to receive any volunteers for this experiment, except for Johan. So the first thing we're going to do is we're going to expose Johan to intense heat, and we're going to show you the absorption qualities of Burnshield in absorbing the heat and preventing the transmission of heat into the wound. This demonstration is reverse what would actually happen onto somebody's arm, in that we are actually removing the heat from an arm onto our dressing and out of the wound and cooling the wound. So this experiment is a little bit in reverse. So, Johan, if you may. We have a propane butane combined flame here, which burns of 1800 degrees Celsius.
I think just to explain, while Max is busy preparing that, it's quite loud. Please do not do this at home. These are trained professionals, they know exactly what they're doing, and we have medics on hand, so please do not do this at home.
We have a typical Burnshield basic, between 20 centimeters by 20 centimeters. And also how to hold up his hand. So we're going to apply it on his hand. And now we're going to apply direct heat, 89 degrees on his arm until the arm starts screaming.
Are you feeling anything?
Yeah. I feel the heat from here.
Alright.
Johan, how was that?
Yeah, but it's still cool here. I can feel the heat here from my face actually, you know, from a little burner. But on the arm, nothing.
Do you want some more?
Yeah, I'm fine.
Okay, I think we can all agree that without the dressing, Johan's arm would have been a well done piece of steak. Alright, we move on to our second experiment, and this is to show you how Burnshield actually draws the heat out of wounds. Again, well, we have not received any volunteers for this experiment, so we had to raid our lab to see how we can actually do this demonstration on instruments rather than on live human beings. So what we have here is a temperature gauge connected to a steel rod, and obviously as we heat the rod up, you will see the temperature move. So we're going to increase the heat this up to a temperature of about 85, maybe a bit more. We're going to apply Burnshield, and we'll see how quickly Burnshield will reduce the temperature from 85 down to 45 at a temperature where it will have no injuries or cause no further damage to the burn wounds. So I'm going to light the fire again. We're going to heat it up to above 85 degrees. We're going to apply the Burnshield. We're going to ask one of the ladies to help us keep time on how quickly Burnshield will reduce the temperature down to 45 degrees.
I think, Johan, would you like to come and read the temperature gauge throughout this session? And you can tell us exactly what heat, what temperature the rod is actually hitting.
So are we at normal room temperature now, about 20 or so?
Yes. So just talk to me a bit about your experience with that.
Oh, very interesting. I should perhaps say on the Arrival Live website we have quite a lot of content on the treatment of burns, because we often get reports from paramedics of fire at home, vehicle fires, fire at businesses. We have content on safe driving near veld and forest fires, even content on, for instance, fire at breaks. And that's why the partnership with Burnshield is important for us. So we have expert advice on how to treat the burns, along with our content on how to stop the fires.
Brilliant. Thank you so much, Johan. Okay, Max is ready for us now.
Alright, so the room temperature is about 25 degrees, which is actually showing. I'm going to slowly heat up the steel. And you should see temperature start rising. You never see it, like almost immediately. Okay, we're going to push it up to a bit of an extreme. Okay, then we've got over 200 degrees Celsius. And we'll move the heat source over. Okay, you can see the heat is still increasing.
Okay.
Okay, so we weigh above 250 degrees Celsius. We're going to take another Burnshield dressing, 20 centimeter by 20 centimeter. You can see it's very stable, so the heat is still there. And now you see a reference once we apply the dressing. Okay, so we would apply the dressing onto the affected wound area, making sure that the gel covers the full extent of the burn wound and surrounding areas as well. And you can see how quickly the temperature drops. Okay, so we're going to ask somebody to record the temperature from 85 down to 45, which would be the typical temperatures of a normal burn wound. Okay, you can see it's dropping very quickly.
About 85, I think now.
Okay, so we're starting a stopwatch at 85. Okay, and the technology around the Burnshield gel is absorbing the heat through the steel onto the dressing. I can actually touch the dressing, the heat is not permeating through and burning me, so the gel is actually absorbing the heat and dissipating it as other energy. Okay, and remove. So now down to about 50. And here we go, at 45. All right, time was?
So it was 31 seconds to 85 from 200 and 34 seconds from 85 to...
Okay, so 34 seconds from 85 down to 45 degrees Celsius. And that is way lower than the 15 minutes recommended for cool running water by the FDA and other medical authorities. So if you want to stop secondary burn wound progression, go find a water source or just buy a small packet of Burnshield.
Well done. Thank you so much, Max. Thank you. And back to Johan. So Johan, do you feel like you've learned a little bit more about
Yeah, no,
Burnshield?
definitely. I've always said, you know, if you want to punt the content, if you believe in your content, I'm not scared to put my body on the line. I was not fearful. And it's definitely something in South Africa. We actually, especially during the winter months, we do have a lot of burn problems.
Yes.
Also in the informal areas, we always find large fires where, I think especially for the young children and stuff, it's important that we know more about treatment of burns, prevention of burns, and the products that can assist with the treatment of burn wounds.
100%. The fact that Burnshield is a sterile product, and the fact that in 32 seconds, 34 seconds, it actually cools the burn as opposed to running it underwater for 15 to 20 minutes, especially if you don't have access to sterile water. So our products are also non-toxic, non-adherent. They are safe to use on children. It has a shelf life of 5 years. This is definitely a product that should be in your house or anywhere where you actually are exposed to a flame of some type, and definitely in your motor vehicle. So thank you very much, Johan from Arrive Alive. Thank you to Max. And we hope you have a beautiful day. And thank you so much for joining us on this live stream, first of many.